Hi, welcome to Dreams for Society, where we imagine, visualize, and create. Please visit us at www.dreamsforsociety.com. And if you'd like to be interviewed, please contact me at lisa@dreamsforsociety.com. If you'd like a one-on-one coaching session with me, please contact me at lisa@dreamsforyoucoaching.com and visit our website at dreamsforyoucoaching.com. Today is going to be such a special treat for me because with us is Dr. Daniel Stock. He specializes in functional family medicine. And I just love all of the things that you gave me in terms of your resume. I can't even begin to mention them, but we're going to start out with him telling us a little bit about how he got to where he is today and all of this beautiful accolades and accomplishments. But I wanted to mention before I toss the baton to you that you do serve as a diplomate to the American Board of Anti-Aging and Regenerative Medicine, and you serve as a founding diplomate on the American Board of Clinical Lipidology. Okay, lipidology. It really is like fat, right? Lipids is
cholesterol
fat.
And fat transport diseases.
Okay,
yes.
Okay, we're not going to edit that out. I botched it. Okay, fine. Lipidology. I practiced that before the camera. So now you know, listeners, that my medical knowledge is about this big, and this is what's going to be beautiful because since he's going to be talking all of this medical terminology, I'm going to have to stop you a lot. Please explain. So let's just get to what is functional medicine, and then also about lipidology and all of that.
Functional medicine, I have a colleague of mine, we joke around that, well, it's just medicine.
Okay.
So in medical school, what we got taught to do is how to identify a symptom that was making somebody complain, and then we would do something to treat that symptom.
Okay.
But we were never trained to figure out, hey, what is it, the biochemistry that led to that complaint in the first place? What started the disease process that ended up with this symptom?
Okay.
And so what functional medicine is to go beyond just symptom management and even beyond system management. So in other words, you don't just look at, okay, you have a cough, gee, let's study what's wrong with the lung.
Right.
But rather to say, let's find out the biochemical process that started off this sequence of chemical events that led to this cough, what it's doing to the lung, and what is it doing to all the other systems of the body, because most of these diseases are related, and if you have asthma, you have an increased risk of dementia and an increased risk of reflux disease, and they're all coming from very common pathways. And our job as training is to get back to that common pathway and teach people how to shut that off, because much of it is actually self-inflicted with the patient not knowing they're doing so.
Are most family practitioners functional? I'm playing dumb. I know the answer to this, but I mean, what is the difference between functional versus non-functional? I mean, obviously that you're looking at the hip bone is connected to the thigh bone and that kind of thing, and the whole the whole body. But are most physicians functional?
No.
Right.
Those of us who do functional medicine would say no.
Right.
There's two reasons for that.
Okay.
First of all, in medical school, it's frankly not taught.
Right.
In fact, one of my favorite jokes is one day I'm going to take my medical diploma down and use it for a napkin because I think that's what it's worth.
Oh, okay. You've got to stay tuned because this is just the beginning.
The other difference, though, is that to do functional medicine requires a lot of time.
Right.
Unless you're going to order like thousands of dollars of tests, you have to take a lot of time asking questions to the patients, putting the physical exam components together, and then kind of coming to this conclusion of, gee, what's the most likely cause or causes more likely of what's going on here? And unfortunately, the present healthcare system actually discourages doctors from doing that. So most physicians, first of all, don't know that this level of understanding is available. And if they did kind of start to become aware that there's guys out there who know how to do this, they would be financially punished by our system for doing so. And so most are not actually very far along in the understanding of the functional level of analysis of disease.
And we're going to get into all this. But in layman's terms, what I'm hearing you say is a lot of physicians can't even think outside the box in terms of functional because they're in the third-party pay system, which we're going to get to in a minute, instead of the direct pay. And if they thought outside the box, then they think they would be ethically challenged or, ostracized or whatever. And so it takes a lot of courage to move into a direction of functional medicine that you have done and a minor amount of your colleagues have done. I mean, I'm sure you're in the vast minority, right?
Yes,
right.
That's a pretty fair statement, I think.
So it's a very brave step that you took. So with that, a little bit of a segue, let's backtrack a minute and tell the viewers who you are and how you got to be where you are today. What got you passionate about functional medicine versus your many, many years of practicing within the system?
That's kind of a complicated story. I'll try and shorten it as much as I can.
Okay.
I think the first thing I'd tell people is that my mom and dad raised me to think very independently.
Oh,
I had wonderful parents they wouldn't give me an answer, they'd lead me to the answer. And,
I like it.
so I was always kind of a little bit of a different doctor, I think, because first of all, I'm a paste-eating science geek. Most people probably don't know that most doctors don't like cellular biology and basic biochemistry.
I didn't know that.
Yeah, and most people are a little surprised to hear that, but my colleagues...
Isn't that a necessity?
Well, you can. Some people like to use a hammer. Some people want to know all the different type of hammers and how you make a hammer. And I'm a guy who wants to know all that stuff too. So most of my colleagues have made fun of me because I remembered the Krebs cycle and I knew how an sp2 hybrid orbital worked in a carbon atom.
The previous conversations I've had with you, it's like we used to call people walking encyclopedias. Well, he's a walking computer. But anyway, go ahead.
So my kind of geeky nature, as you got through medical school, you would ask things, you'd say, well, I don't understand how that happens, and the answer would be, well, nobody knows. And you'd say, okay, well, I'm going to accept that for a time, and you go forward. But then, as you learn more and more, there's some things that come out that kind of don't make sense to you, and you're taught things like, osteoarthritis, that's overuse of your joints. And I'm like, okay, well, but, I had osteoarthritis at the age of 36, Chris Chelios was playing professional NHL hockey at the age of 42 and his hips were fine. So how can that make sense? That doesn't really work with me. And I would ask that question of, no, that can't make sense.
Yeah.
So as I went on through my career, more and more episodes of that started to develop. I think simultaneously two things happened. One of them was that I got sick, and that's with my hip disease, and the explanations I got didn't work right. And
what age were you when this happened?
38 37 when I was first diagnosed with hip disease. Very young for someone having hip arthritis. Yeah. But simultaneously, at the same time, there was another very horrifying thing where I had a 38-year-old Air Force flyer in excellent physical health, no family history of heart disease, no other medical problems.
He was a patient.
Patient of mine. Okay. His only medical problem was a history of asthma and erectile dysfunction, who came to my office on Wednesday morning and said, Dr. Stock, I was playing basketball this morning. I had a little chest pain came on. So I asked him all the right questions, and it didn't really sound like blocked artery heart attack disease. And I said, well, Mel, have you had anything to eat this morning? And he said, no, I haven't. So, okay, we'll get a fasting cholesterol panel on you. So I got his cholesterol panel back, and everything is pristine. I see him back Friday morning. It all looks just great, Mel. Your HDL's high, the LDL's low, triggers are right with everything's wonderful. Guys in your history don't have heart attacks and strokes. And then I had this little voice in the back of my head that said, Danny was exercising when the pain came on.
Yeah.
So I kind of scratched my head.
I'm getting chills.
Yeah, so I say to him, Mel, look, I'm just sure this isn't a heart attack and stroke, but, there's this one little chance, and my colleagues are going to laugh at me if I order any further testing, but, it's worth doing. So let me get you a treadmill on Monday, and at the same time, if I'm going to get you a treadmill, I have to send you home with a bottle of nitroglycerin just in case. I don't think you use it, but here's how you use it if you need it. You're probably not going to. And then Monday morning, I'm standing at the nurse's station. I get a phone call from the cardiologist who's supposed to be doing the treadmill. And he says, Dan, I want to talk to you about Mel. And I said to him, Scott, I know this is a really weak call. The story's not right. The labs aren't right. But, if you don't think he doesn't need the treadmill, then you can just say he doesn't need it and we'll cancel it. High false positive rate, I get that. And there was a pause, and Scott said, wow, Dan, I'm surprised to hear you say that. Because I was calling to figure out how you pegged this for coronary artery disease. That nitroglycerin is the only thing that kept him alive Sunday night till I could get the stent in his 98% blockage left main coronary artery. And I went diaphoretic at my nurse's station because in my heart of hearts, with everything I'd been taught, I had given this man the best advice that traditional medicine had taught me to give him.
Right.
And as luck would have it, there was a rep for a laboratory company standing nearby who saw me go diaphoretic at the nurse's station. Dr. Stock, what's wrong? And I explained to him, I was like, look, I gave this guy perfect advice, and just by the grace of God, I didn't manage to kill him. And they said, well, there's this test you need to know about. And so it told me a little bit about this test and arranged for me to go to a lecture from Dr. Bill Cromwell, one of the most inspiring and brilliant doctors I've ever worked with, and certainly I would consider him my mentor, who explained to me all of the things that we had learned in medical school about cholesterol that were wrong, and the basic science data that said they were wrong.
Right.
So from there on, I started to get a reputation as kind of the cholesterol transport weirdo of Indianapolis, as the guy who didn't really think cholesterol blood levels predicted heart disease and that these drugs didn't work by treating cholesterol levels.
And this was when you were about 38?
Yeah, it was around in there. It's still around.
All this was happening at the same time with your hip, questioning your hips, and then the patient Mel. Okay.
And, I've noticed that I started doing lectures. I've actually paid by the pharmaceutical industry for a long period of time to go ahead and do lectures on cholesterol transport, because I used very different drug combinations than other doctors did.
Oh.
And so I was profitable to one company or another, and they would say, well, we're happy to give you your information. I ought to tell you some stories about that later on that'll curdle your blood. But
wow.
So I started to get this reputation kind of as the weird guy.
Right.
Mostly because I was this basic science geek and drove everything back to, hey, that's not logical. I got to get back to the chemistry of it.
Right. You could connect the dots where others couldn't.
Yeah.
And you had the intuition as well.
And probably the I should say, conceit to not stop thinking when I was told to.
Well, good for you. You had faith in your own intuitive messages, which some people could say is arrogant, but no, I'm not going to call you conceited.
One way or the other, when these other arguments didn't really support me, it started, moving down a path of, hey, look, the people I used to trust, that when they told me this is the sum total of knowledge, I began to realize that I can't trust them as much as I used to, and so I would read a lot of literature that other people wouldn't. Unfortunately, most doctors actually don't read original research anymore. They only read guideline summaries and things like that. But I was the guy who actually wanted to go down to the biochemical level.
Wow.
So, unfortunately, as this was going along, there were some other things that kind of coalesced, and that I was elected by the physician group to the board of directors of our physician group at the health network I work for, which by contract I'm actually not allowed to name.
You had to sign an NDA, a non-disclosure agreement.
As part of being an employee of the hospital, you had to do that. And as those negotiations went on, you began to realize that the insurance companies were more and more, especially with the government, leaning on what was going on in healthcare advice. And they, around the early 2000s, started actually to say, we're going to pay doctors differently on whether you give the advice that we think is good healthcare or not.
Oh.
And unfortunately, much of the optimal advice that would tell you how to be cured, unfortunately, wasn't very profitable to the present healthcare system. And they began to make it harder and harder for you to actually
practice medicine.
Yeah, you would be financially less rewarding if you were doing the optimal health versus what was this is the accepted guideline it's supposed to be.
Let's back up for 1 second.
Sure.
I want the listeners, I'm just hearing them say, Lisa, question him a little bit more about this NDA. So the NDA was signed when you left the employment, right? No,
when you became an employee of the hospital system, you had to sign in this contract that agreed, first of all, that you would not be able to contact any of your patients if you ever left.
Right.
You would not be able to practice within so many miles of your location.
Non-compete,
That you had to deny you had a contract with the health network.
Well, that I don't understand.
Well, these health networks actually, because of the ropes that are put on them by the insurance company and the government, their financial survival is dependent upon getting doctors to do what the government and the insurance company wants. But to use the trust that is in the doctor-patient relationship, the only way that trust can be maintained is if the patient doesn't know how coerced his physician is. And so it's important that they not have the patients know that their doctor is under the financial hooks of an organization and a situation that can do this to them.
Okay, so I'm not connecting the dots in my own head. As a lawyer, I'm trying to here. What I'm hearing you say is that the hospital didn't want a court of law, if there were ever to be litigation, that a patient would sue you as a doctor for not treating them the right way.
I don't think it was so much for the doctor's legal protection. There is this.
I mean, how is the hospital protected by you signing the NDA that you can't tell anybody or any court of law?
Well, because then I wouldn't be able to go out and say, hey, when I worked for such and such network, they had these financial influences that they were putting on me, that I'd get paid less if I did this or if I did that, and that every other doctor in the system is being paid less if he does this or does that.
Could you testify in court that information? If
I could testify that I had the influences, but I couldn't tell him it was X hospital.
That's what I'm getting at. That's what I'm getting at. I just cannot believe this.
And so the idea, I don't think many patients know that their doctor is against his will in most cases, being financially coerced to a point of view. And for that system to continue, it's important that the sham that this doctor is independent and thinking only of you has to be maintained. And so you can't have the doctor telling people that, I have hooks in me.
Yeah, you have hooks in you. And, just so the listeners can understand that I'm right there with you, when I was 41, I walked into my gynecologist's office, and she said, Lisa, you're 41. Did you know that menopause is a disease? I'm like, what? It's a disease, Lisa. So you're 41. We need to get you started right now on birth control pills. Well, I want you to know, Dan, I did not. I was a young girl and decided to do other birth control measures like IUD and the diaphragm and stuff. Okay, whatever. You're a physician, so we can talk this stuff. And I only did birth control for a year and a half because intuitively I thought, this is not right, this birth control pill. And she wants to put me on birth control to somehow ease me into this disease of menopause. I didn't understand it. And then she said, okay, then after you're on birth control, low dosage or birth control pill for like 3 or 4 years or whatever it was, then we're going to put you on, or maybe it was less, maybe 2 years, we're going to put you on this these hormones. I said, whoa, wait a minute. I'm not doing synthetic hormones, because back then it was all synthetic hormones.
Right. Still mostly is.
And I said, if I do hormones at all, it's going to be non-synthetic or whatever it is, the opposite. I'd heard a little bit more about this, and she started, as a physician, telling me what she believed, and I said, Doctor blah blah, I won't mention her name. I said, you've just got to. This is way before I started representing the pharmaceutical industry. Like I took over the client from another person, and I ended up having to fire the pharmaceutical industry. That's another the client I had because I couldn't take it anymore. But I said, Doctor, I said, I just don't think you should believe everything that the pharmaceutical reps tell you when they come in. And she's like, well, okay, but don't believe everything you read either, Lisa. So, I mean, as a patient, I stood up for myself. Or else I would have been on this regiment that I think would have really hurt me.
Well, and in fact, I really have to salute your thinking on that a lot,
okay.
Lisa. In fact, one of the fundamentals of my practice at Pure Health Family Medicine is the doctor in this relationship is the servant and never the master.
Oh, I love that.
At least this is the way I make my physicians interact with me, is that they are paid rent-a-brains.
Rent-a-brains.
Rent-a-brain. I mean,
you need to trademark that.
Well, think about it. When you go in to see your physician...
I see the title on the book right now. But go ahead.
It's not eloquent, but I think it really conveys the meaning.
It cuts it down to the bottom denominator here. Cut to the chase.
I mean, what you want this person to do, because it would be very difficult for you to go see a couple 100,000 patients, read all of the biochemistry, and just do this, and then come out to say, hey... Knowing all of the stuff that you can learn through studying experiments and then predict what will happen in every course of action that I can take regarding my health so that I can choose which one of those outcomes is what my definition of good health care is.
Right.
Well, that's a very complicated process and very difficult to do in a system where the doctor is told you're not going to get paid as much if you don't make this happen.
See, I didn't understand that then. I just knew that she was somehow hoodwinked on what the pharmaceutical reps were telling her. I didn't know she was, that there was a connection there,
I think most people don't, but for instance, your family doctor, if you don't get a certain percentage of your kids vaccinated with these vaccines, you get your pay cut.
Well, let's go to that. Now, I love this because in one of our conversations off camera a few weeks ago, you told me about the two most compromised physicians out there, the psychiatrist and the pediatrician. Can you explain that? And that's all into the third party versus direct, or third party pay versus direct pay that we'll get into.
So they're in the insurance company and the government system. They have somebody, or usually it's a group of hired guns, who are decided to say what service.
Lobbyists.
What service is worth how much money?
Right.
And so for instance, it's been decided that if a doctor sees 10 people for 6 minutes, he's going to get paid better than if he sees one patient for an hour. That's how it's arranged. So when you have this situation of a physician who knows that, look, I came out of medical school $200,000+ in debt. Yeah. I go to work for a hospital, and that gets part of my debt forgiven, but only if I remain for the hospital employment, which means if the hospital fires me because I'm not doing what I want, then I get my debt all back.
The hospital pays for half your debt?
They can pay for all of it if they want to. They can pay for a certain percentage of it, but that payment is contingent upon the fact that you stay employed.
The NDA.
Yes, you have to become employed.
And you have to sign the NDA.
So you don't get employed if you don't sign the NDA.
Is this like a criminal act? Or what is this?
Well, I'm not an attorney, so I can't say whether it's criminal or not.
Okay, go ahead.
I can certainly tell you it's not very compassionate. That's for sure.
Wow, blackmail is what's coming.
Well, it's hard not to characterize it as that. So,
yeah.
I mean, when you're a physician, and it gives people the mistaken impression that your doctor is sitting there twirling his mustache and just profiting by misleading you.
Yeah.
But it's not. There's a lot of medicine that operates in the gray area. And when you operate in the gray area as a doctor, you're trying to decide, should it be this or that? And in the back of your mind, you know that if I choose this, if I tell them of this, that my family will be harmed. And I will be harmed without knowing it. The doctor starts saying, well, I think I'm going to listen to what the drug rep says. I'm going to listen to these sources of information and discount these other sources of information as not being meaningful. So I'll give you a great example of that. There was a colleague of mine who's in traditional medicine, employed by insurance companies and the government systems.
Traditional medicine being the opposite of functional medicine in a sense?
Yeah, symptoms is what we have been trained to do. That's what we take care of.
Right.
And I went to this gentleman and said, wow, you really need to know about this case. Using Shoemaker-Bredesen protocols, they're actually able to cure an Alzheimer's patient. And it was thoroughly done. He had a positive floor beta pure scan, and that cleared up, and his brain cells regenerated. And the gentleman's response to this was, well, it's just one case. And as the
there was a guy named Shoemaker.
There's a physician who came up with a treatment protocol.
For this billionaire or something, right?
It was for a CEO of a corporation.
Okay.
I mean, it actually wasn't for him. He had been using it for years. It was just another Dr. Bredesen saw what his analysis and breakthrough of treatment protocols would do, applied it to an Alzheimer's patient, and cured the Alzheimer's patient.
So it wasn't peer-reviewed or all of that, but it was...
Well, actually, the literature is peer-reviewed, but not published in any journal that's paid for by advertisement of drug companies and device manufacturers.
For heaven's sakes. But to backtrack just a little bit on this is a very interesting case, because you did tell me about that a few weeks ago. So this Dr. Shoemaker was treating this CEO who had Alzheimer's.
Dr. Bredesen, actually, using the Shoemaker protocol.
Oh, I'm sorry. Yeah, okay. The Shoemaker protocol, which was something that Dr. Bredesen found out about.
And then said, hey, that should work in Alzheimer's.
So how long? Oh, okay. So it was an inflammatory protocol.
Inflammation regulation.
See,
reducing
how much
inflammation.
I know about the medical terminology. So he just connected the dots and thought, how long had the Shoemaker protocol been around?
Shoemaker had been doing it for about 10 years and probably been publishing on it for at least 6 or 7
years.
So
it's something that is peer-reviewed, but not in any advertisement or any journals that are advertised by them. Okay, so it's some kind of Shoemaker protocol that reduces the inflammation in a patient.
Corrects the brain's ability to control inflammation.
Okay, corrects the brain's ability to control inflammation. Right. And he connected the dots and thought, well, wait a minute, I think that Alzheimer's is inflammation. Mm-hmm. So if that's working on arthritis, the arthritis in the hips or whatever, maybe it'll work on the Alzheimer's.
Correct.
And this CEO was like at the point of like 80% on a scale from 1 to 100%?
He was down to the 5th percentile of the population for intellectual function.
Oh my goodness.
Meaning the poor man is dumber than 95% of the population.
Oh my goodness. And he used that Shoemaker protocol for how long?
He was treated for, I believe, 5 months.
5 months.
Yeah.
And then went from the 5% to what?
75th percentile.
Okay. I just wanted to
Yeah.
go over that. Okay, so you're aware of this. Not all of your peers are.
Yeah, you had to go do some extra. You had to go look in some esoteric corners of the room to find that information.
Wow.
It wasn't published in New England Journal of Medicine or JAMA or Lancet or any of the ones where supposedly important studies get published.
So what year was this that the bells started ringing with this?
The last part of that, just actually last year, did I learn about the Shoemaker-Bredesen protocols, and that we could actually fix the part of the brain that regulates inflammation, and that we could rehabilitate that and make it go back to normal again, which is treated chronic inflammatory response syndrome is the name of that process, but it's been shown to treat chronic fatigue syndrome, fibromyalgia.
Parkinson's?
Parkinson's not yet, although to be honest with you, I suspect strongly it works for Parkinson's. Parkinson's is just a variant of Alzheimer's when you understand what's happening in it. We think it
Multiple sclerosis?
Multiple sclerosis, a little bit different, but probably. I'm going to be seeing a patient later on today who's going to be probably get some benefit from a modification of the Shoemaker protocol, I think. But we already know it works in resistant depression, resistant anxiety, PTSD, post-concussion syndrome. These are all patients who have been cured by this understanding of inflammation regulation. But I think the most disturbing thing about this story is that I went to a physician and said to him, wow, these chronic diseases, which are the pestilence of America today, we have a cure now. Somebody survived it. And his response is, well, it's just one case. And I tell people, I wonder if you're a physician who could only make his money by giving advice, would you have that same response? And I can't help but suspect it's not. When I used to lecture on cholesterol transport diseases, we had a regimen as of the year 2000, I believe, the Hatch trial was published, that showed that we could take very sick people with coronary artery disease, and in 3 months, we could prevent them having heart attacks and strokes with a regimen. And I would do lectures for doctors and hey, this is why you do this. Yes, the one drug is, you have to do a lot of education with it. Patients have to comply with it, but it's got some tricks you can make it work with it. And it seemed like no one was adopting this. And at one of these lectures, we were paid by a drug company to go do the lecture and then go to a football game afterwards. So my wife is sitting beside a cardiologist.
No, wait, let's back up. So you were paid to go to the lecture.
To do the lecture.
And then you were treated to a...
Me and all the doctors were treated at the football game afterwards.
Yeah, okay. And there are studies that show just handing somebody a bag of peanuts will influence them.
Yeah, I understand. Yeah, I think actually there's less influence caused by that than there is the financial constraints put on the doctor.
You're right. Yeah.
But during the football game, my wife is sitting by this cardiologist, and she kind of likes to get a feel for, gee, is Dan worthwhile or not? And she asked the cardiologist, well, so what do you think about the science that Dan presented? The effect on heart attack and stroke. And his response to Elizabeth is, I'd never be able to make my boat payment.
Oh, no.
And this was an uncoerced comment.
Oh, no.
But I think it indicates that, wow, there's in medicine right now, we've almost got a healthcare system that profits from the maintenance of disease. And if you want to be a superior physician, one of the things you have to accept early on in your career is it's your job to bankrupt yourself. That really is.
Which is what you did. You didn't bankrupt yourself, but you let go of the big bucks in the traditional medicine world, and you're now into the functional medicine world as a private practitioner in family practice. And you're going away from the third-party payment system into the direct payment system. So talk about that. Tell the listeners what the difference is.
So when you go to a doctor who is paid through your insurance company or the government program, there is somebody else in the room besides you and the doctor. The doctor knows that to get that money that you gave to the insurance company or the government, to get that money out of there, he has certain things he has to do. He has to enter certain things in that computer, which is why he's never looking at you, because he knows he has to enter that data.
Yeah.
But also he has to record advice, or has to give you advice that will make you do certain things. Get a mammogram, get a pap smear, get a vaccine, take your cholesterol medicine. And if those things aren't happening, then his pay will be cut. And you got to remember, he knows that if his pay gets cut enough, the hospital's going to fire him.
So if I'm a non-conforming patient, his pay gets cut?
That's correct. You actually cost him money.
Oh, you're kidding me.
No. I mean,
so when
in fact, we had
told
doctors who would actually dismiss non-compliant patients from their practice because they were financial threats to them.
So when I told my pediatrician I'm not doing any of that,
I have
obviously
patients in my
cost her
practice
money.
who came to me because they said, Dr. Stock, I was dismissed from such and such pediatrician because I wouldn't vaccinate my children.
Well, I've heard that a lot of
Right.
times.
And that's why a doctor would actually, you'd say, why would a doctor give up a paying patient? It's like, well, because the way the system is right now, that patient can become a financial threat to that doctor and his family.
So I want to do the psychiatry aspect and the pediatrician aspect, the psychiatrist and pediatrician. Let's start with the pediatrician first and go through that with the third-party pay versus direct pay and how that would impact why they need to, just walk through.
So in the example of a pediatrician, you walk in, you say, Doctor, I'd like to have an intelligent discussion about the risks and benefits of vaccines. Well, you're having that discussion with somebody who knows that if he lets you know the downside to vaccines, he's going to lose money.
Okay, explain that.
Well, because there's a requirement that X percentage of your people have to be vaccinated with X, Y, and Z vaccines.
And that's a CDC protocol, right?
It's actually something that the government and the insurance companies have set up to tell the hospital that employed you that we're not going to pay you as much if we don't see this. Or,
backed up by the CDC, right?
Okay, fine. Yeah, whoever the government or the insurance company chooses to give them advice, they're going to make these rules up. And if say you're not employed by a hospital, well, you are getting kind of clingy here.
This doctor has great bedside manner. Oh no, little girl, you need to jump off or something.
Well,
I love this.
You have to put up with a kid throwing up on you if you're going to be in this business. So sometimes you got to live with a cat crawling on you.
I've never seen this in an interview. I love it. The people oh. Little girl, come
My
here,
wife's
come
going to
here.
talk to you about that sweater, you know.
Oh my goodness, let's make sure there are no snacks. You're good.
It'll survive.
Oh my goodness, little girl.
I tell people, when you sit down to have this conversation with his pediatrician, you have to understand that they have this financial gun to their head. Now, they may be trying very hard to ignore it, but when you understand, any human being who's been put in a conflicted situation knows that it has an effect.
Okay, let's do a little role playing. I love role playing on this show. Okay, I'm a mother, a lot younger than I am now, but let's say my daughter, who's going to be 32 in a couple of weeks, let's say she's newly born. She's, back in those days, they didn't get the 26 vaccines on day one. And I take her in, and I was so stuck in the system. I mean, I did everything, I didn't start questioning until later.
Right.
But I listened to my pediatrician because he's a nice guy and he knows his stuff. And so I come in and I say, act like you're my pediatrician.
Okay.
Dr. Stock, tell me what we need to do today. And my daughter is 6 weeks old and she's coming in for her first round of whatever.
So let me first of all play what I think happens if you're in the traditional way of paying your doctor.
Okay.
It's then they need these and these vaccines.
So you're the traditional doctor right now.
Yeah,
okay.
They need these vaccines. It'll be good for them.
Well, Dr. Stock, I have been kind of reading, this is 32 years ago, but something in my head, are you sure, Dr. Stock?
Oh, yes, all the literature says it's good for your kid to take this vaccine.
All right.
So then the way I would phrase that if someone comes to my office,
right?
Because I actually am a proponent of vaccines under certain circumstances.
Okay, in the real world now, in the functional
So
medicine.
if you're in my office, I'm going to say, well, is your child breastfeeding, and are you going to breastfeed past the age of 6 months?
Okay, which I did.
And if you tell me I'm going to do that, I say, well, okay, then you've actually done a great deal to teach your children's immune system, because the immune system has to learn. We're born without one that works. And it has to learn how to function to react to what it needs to and not react to what it should not react to.
Okay.
And breastfeeding has an enormous component of doing that for somebody.
Which is a wonderful question to ask as a functional doctor that a traditional medicine person maybe wouldn't ask.
Or may not think that it has anything to do with vaccines.
with it, exactly. Right. Gotcha.
So once I know that, then I would say, well, okay, now I need some family history. Do you have fibromyalgia or any other neurologic or immunologic diseases?
Or hepatitis?
Hepatitis.
Now it's day one, but back then.
Hepatitis less of a, actually, truly an immunologic disease, since most hepatitis, your immune system, if you've got a healthy one, will fight off without problems. But if a mother looks at me and says, yes, as a matter of fact, I do have fibromyalgia, I tell them, well, that means I know you have an immune system problem from the get-go.
Oh, okay.
Your child may have been exposed in utero to biotoxins, and boy, I would probably recommend that the vaccine schedule be spaced out and that we use transfer factor supplementation to ameliorate the risk of vaccine, because there is risk to vaccine. I think we all...
Why?
Well, because
Doctor?
the immune system, by definition, is going to be perturbed by the vaccine. We already know it unbalances your immune system. So your immune system has two different arms by which it attacks. It attacks with the Th1 arm first, and then after it's got the thing under control, it switches to the Th2 arm to prevent a reinfection. And what we're doing is short-circuiting that process by using this vaccine to immediately start a Th2 reaction. There are some complications and risks you take with that when you do that. The risks are probably outweighed by the benefits in most people. But if you come in with certain things that are against you, then I can say, well, your risk is elevated, and now in this risk, we should probably either delay or space out treatment.
Space out. So
and
the
give
fibromyalgia, which is a
neurologic condition,
and a challenged immune system, told you that because the biotoxins may have been
exposed to the baby in utero, that this baby may be one of the rare cases that is going to have problems with vaccines.
Really, doctor? I mean, thank you so much for telling me this.
Well, and that's again, think how much difference in time was spent between those two explanations, and a doctor who knows he's going to be paid more for seeing 6 people.
It sure is a lot more than 6 minutes.
Yes, it is. In fact, my wife tells people I'm paid to bore people to death.
But doctor, what's Th1 and Th2? You lost me on that.
So your immune system starts off with what's called a Th1 reaction, where it has white blood cells that are specifically designed to crawl through your tissues, looking for things that shouldn't be there, and attacking and destroy them if it finds them.
Okay.
Then after it's gotten rid of the cooties, it switches over to
the
Th2.
The cooties I can understand.
Yeah, that's a nice medical term that communicates. Then it switches over to the Th2, which is the making of antibodies.
Oh.
And antibodies in medical school, we were taught fight disease, but the reality is they don't. They prevent the recurrence of infection. That's all they do. They don't go through your tissues.
Dead silence after that.
That's right. Because when this was first pointed out to me,
I've never heard that.
Well, imagine how I felt. Here I am, this practicing physician. I'm like, oh, that does make perfect sense. That's not what I learned in medical school.
Just went through.
Yeah, that's not what I learned in medical school.
You've got to be kidding.
But the entire idea of giving this vaccine was to make it so you'd have these antibodies to prevent an infection should you get it, so that it would take more infectious cooties to overcome you.
Right.
It's a very reasonable manipulation of the immune system, but it does come at a cost. That cost is usually very small, temporary, and doesn't cause any lingering effects in the vast majority of people. But in some it does. But there's another explanation of vaccines that people really won't get into, and that is, well, not all vaccines are as beneficial as others. So, the flu shot is a great example of this. You can say, does the flu shot save life? And I will tell you that, without question, I believe it does. If somebody says, does the flu shot cause side effects? I would say, without question, it does. There are some people who are going to have some rare problems that come from it, not just Guillain-Barré syndrome even. But then everybody said, well, doc, is it worth the money? I would say, well, this is not your doctor's decision to make. This is always your decision to make.
Empower the patient.
So when most people get influenza, do they die from it? Oh, no, most people don't die from influenza. Only the sickened and the weak die from influenza. Most of the deaths occur in the elderly and people with an immune system or neurologic disease. So then the question has to come up is, well, gee, Dr. Stock, is the benefit of avoiding 5 to 7 days of body aches, coughing, high fevers, chills, is that worth my $20 if you don't get it paid for through insurance? I'd say, well, this isn't a medical decision. This is a personal decision. And I can't be involved in making that other than to serve as your rent-a-brain and present all of the data.
Your rent-a-brain. I just love that.
But, when you think about it, you don't want your physician, especially if your physician is going to make money on the labs and x-rays and all the things he recommends, you don't want him to have a financial dog in that fight.
I mean, come on.
It changes his advice.
This is a whole new perspective on informed consent. We don't have informed consent if we don't know the connection.
You have coerced consent. You have coerced information.
So I've read, and I don't know if this is true, but pediatricians would lose like $700,000 to $800,000 a year if they didn't vaccinate according to the protocol.
Well, I don't know what the number is, but I think people don't even know the bigger problem, which is if you're not making enough money for the hospital to work with, you're going to get fired. And if you get fired, you can't practice within 20 miles of your location, and you can't contact your patients and tell them that you had a difference with the hospital.
Right.
So a doctor's lifeblood is the trust that his patient has in his advice.
And they're thinking that he got fired for some nefarious reason, got let go.
Well, or you know that you will have only option is to go out and start up a practice, which is extremely expensive and a financial risk.
Which has to be 20 miles away.
Right. Or you can go to work for another hospital. Well, you'll be right back in the same situation. Or you could go on your own and try and work for insurance, but the insurance company is going to pay you less if you don't have a certain percent of your people vaccinated. And so you stay with the system because you don't see another way out.
But you did. You did. You got out. And I guess because, did it just feel so uncomfortable?
Well, it was a combination of that and being escorted out. So I can tell you the stories that actually led to this. The hospital network I worked with had a meeting where they showed that they were basically getting ready to go into the red. And so they said, we're going to change around how you're paid. And the way they were going to change around the pay just kind of disguised the fact that we were going to have incentive payments with it that were getting bigger and bigger. Oh, no. And I raised my hand at this conference and I said, well, look, tell me if I'm missing something. I used a little more colorful language than that, but I said, you guys are clearly going into the red on the hospital side of the equation. The only way you can stay in business is take money from the outpatient side and pump it into the hospital. So why wouldn't it be better for all of our patients and us doctors to leave hospital employment and go out on our own?
Oh.
And they fired me in 4 hours.
That doesn't make any sense. You asked a question.
Well, but this was an insight that is very threatening to the healthcare system. And I don't want anybody to think that the hospital is twirling its mustache. You have to understand they have a financial gun to their head by the government and insurance companies as well.
Right.
And CEOs in hospitals nowadays, when I started off in medicine, they made about the same as a family doctor. Now they're making $2 million plus.
Right.
So this
what
is both
that
a person.
About?
Well, they get paid a lot of money to maintain the system.
To make sure that all of the doctors conform to the system.
Right.
And when the incentives keep upping, which I'm assuming you're talking about incentives from the pharmaceutical industry.
Well, it's incentives from the government and the insurance companies to do this.
So explain that. I mean, I know that the insurance company is dictating almost how you practice medicine. But who's dictating to the insurance company?
I would tell you that it's a collusion between that and the government is the best way I could describe it. That sounds really nasty, but one of the effects of the Affordable Care Act, they passed a rule that said that an insurance company had to spend 80% of its premiums paying for medical services. Okay. So it could only send 20% to its stockholders. Well, that means that the only way you can increase the revenue of the stockholders and therefore the bonuses of the people who run the insurance company is for people to buy more health care. So now they converted insurance into a prepayment scheme. Now you might ask, well, why would my government do this? And I say, well, you don't understand. Hospitals lose money on every Medicare and Medicaid patient who comes in the hospital. They make this up by pillaring the wallet of everybody with private insurance. But that Ponzi scheme is beginning to run out of money. And so the government, the Affordable Care Act, was there to force people into the insurance company prepayment scheme so that they could buoy up the Medicare and Medicaid system.
This is complicated. I mean, you made it sound very simple, but it's hugely complicated. And it almost sounds like, it just sounds so corrupt to me. I'm sorry. It just sounds so corrupt.
It certainly isn't compassionate or well thought out.
So how did we get ourselves into this mess? I guess is a big question. What I love about what you're doing, though, is you saw what was happening. You challenged it in a public meeting with your peers. You were escorted within 4 hours out the door. Unbelievable. But such bravery. And now, today, which is just a few months later, really, right?
This is actually in 2013.
Oh, 2013. Okay.
Yeah. And so, interestingly, in between there, I went to the solution that was supposed to solve this, which was the employer clinics.
Okay.
So at the time, I kind of realized the system was working badly, and it made me very uncomfortable.
Yeah.
But I didn't have much cash reserves at this point.
Okay.
The wife and I had been living a little bit saving money because we realized things were uncomfortable. I felt this
Right.
very badly.
For a while, yeah.
So I went to work for an employer clinic, and the sell job was, well, we don't bill insurance. We have a flat rate for the employer. Well, this is going to be good. You know, it's going to be much better. And they say, oh, you're going to have much more time with your patients, which I did.
Oh, good.
Until one day the company running this employer clinic came in and said, well, you know, we had a few people complain to the employer. They thought it was weird you told them to take vitamin D. And I said, well,
No.
yeah. And there was only a few patients. And I said, well, let me talk to the human.
Through blood work, you were able to detect that they were low on vitamin D.
Well, statistically, I can tell if you're not taking it, I know you're low. And I can explain that on a science basis.
All
But
right.
so I tell people, look, just start taking. In 3 months, we'll get a test to see if it's up where it would be best. And they said, well, look, let me explain this to the employer. Well, you have to understand, employer clinic people who run employer clinics don't want you to talk to the employer because they're afraid the employer is going to find out they don't need the company, they only need you.
Wow.
And so they said, no, you can't do that, but you have to make it so we don't get any more complaints for this employer. Well, so I gave them my resignation. I said, you can revoke this if you'll let me talk with the employer, but the person who's talking to me is a second grade teacher by training. He can't explain the biochemistry and science behind this. And I said, I can't not advise a patient if somebody's been shown to reduce the risk of cancer by 80% just because you're afraid of a few complaints with this employer.
Now, who complained?
One
Dan?
patient did.
One patient.
Yeah.
And that
The
doesn't
vast
make any
majority
sense.
think this is a wonderful thing. They take their vitamin D after I explain it to them because it makes so much sense. But one patient complained, and of course, when you're an employer clinic manager, you don't serve patients, you serve this employer. And you don't want this employer to become in any way thinking the clinic is bad.
Yeah, but how could one patient's complaint?
Because this is a
Topple it
businessman
over.
who has second grade teacher training. He doesn't understand healthcare, but he's got control of the money. And so he doesn't
Vitamin
want
D
this.
is that big of a threat to the pharmaceutical industry?
Complaints
Okay.
are a threat. To
Unbelievable.
this employer clinic. The pharmaceutical company isn't, but the employer is a threat to the guy
Well,
who
but
has
what I
control of the
mean
money.
is vitamin D can't be patented because it's...
Right. Oh, it is a threat to the... Yeah, in fact, there's a funny story about that.
Yeah.
One of the pharmaceutical companies one time sent out a flyer to all of us who run their speakers bureau and said, hey, we think this vitamin D receptor may be a useful thing we could do. Give us some ideas of what we should do for this. And I sent back the note that said, well, how about using vitamin D? And I never got a response.
Yeah, because they have to finagle it some way to make it chemically altered so they can patent it. Oh, for gosh sake.
Yeah.
Vitamin D receptor. Yeah, just use vitamin D.
Yeah, that never got a response.
And they didn't
Funny.
have anything in the lab, or there wasn't anything in the, yeah. Oh my goodness. Okay, so no vitamin D pill you can take other than the real vitamin D.
So I actually resigned from that company because I
Okay.
could tell they were going to constrict what I could advise patients on. And after building up some more just working urgent cares, I got another company that came and said, hey, we heard you're just the bee's knees. We want you to come work with us.
The bee's knees.
Yeah, that means you're just a great preventative healthcare doctor. You teach people how to stay healthy and get healthy.
Oh,
And
good.
That's been my reputation. I'm big into lifestyle modification, dietary
Right.
stuff to prevent and treat disease because Shoemaker protocol doesn't work if you eat at McDonald's every day.
Yes.
So this
Yes.
other company comes up and says, well, you're great. You should come work for our employer clinic. And I said, well, okay, but we have to have a meeting between you and me and the employer
Okay.
beforehand because I want to make sure that on anything clinical, I can talk directly to the employer. And the employer, we had this meeting. Oh, yeah, we all agree to this. So this is a local county government clinic I'm working for, by the way. And then I started diagnosing a great many of their patients with mold-induced biotoxic illness. And I was doing lectures once a month to teach their people how to stay healthy. And in the high blood pressure lecture, I put down here that mold biotoxin illness would cause you high blood pressure.
So we're talking about mold, M-O-L-D.
Yeah. Uh-huh.
Just for the listeners, not M-O-L-E.
Yeah.
And just to backtrack,
Uh-huh.
you've just recently discovered through an off-camera conversation that food, McDonald's we're talking about, and food and mold cause inflammation. The two
Correct.
biggest. Okay, just wanted to throw that in. Okay, go ahead.
So I'm getting ready to do this lecture on high blood pressure, and the company that manages this employer clinic comes and says, well, the county wants you to take that stuff about mold off of the slide.
No.
And I said, well, I can't do that. You can take it off the slide, but I'm still going to talk about it. So then this is 2 days before the lecture. The day of the lecture, they said, well, the county said you can put it back on the slide, but the office manager said, you should be careful about what you say. And I said, well, I'm going to say whatever science tells me it says, and that's it. So as I started diagnosing more people, more and more of these patients were telling me, Dr. Stock, I know the place I work in has mold. And then one of them actually said, Dr. Stock, I can't be cured until I'm out of this moldy building, but I can't afford to use my job. Could you call up this employer, the county government, and tell them my situation so they'll know what it is? And I'm honor bound as my patient's advocate to do so. So I tell the office manager, hey, you can get me the message of the human resources director. And they said, you can't talk with them. And I tell the office manager, well, look, we talked about this beforehand. Your superior knows we agreed to this, and I don't really have a choice, even if you don't like it. As a physician, I have to be my patient's advocate. So I call up the human resources director, who won't take my call. I leave a message that, hey, my so-and-so has asked me to speak with you on their behalf. Please call me back so I can tell you what the patient needs to do about this. And one of the county commissioners, I've actually spoken about mold biotoxic illness at one of the lectures because her family was involved in suffering from this.
Oh, wow.
Pretty sure as well, I could tell them. And then a week later, I got a write-up from the company that runs the employer clinic saying you've been written up for disobedience for speaking directly to the employer.
Okay, so that was the roundabout way of getting at you. So let's backtrack a minute here. Now, the county is not going to want to be exposed from a litigation standpoint.
Or the expense of cleaning up their buildings.
Right, because mold is a very expensive thing to eradicate.
It is.
So A, I can see why they didn't want that in the PowerPoint. And B, I'm wondering, is there a pill to get rid of mold in your body?
There isn't.
Okay, that's my point.
Well, I mean, we can get the toxin out of you, but that won't allow us to undo the damage by itself.
But not with a pharmaceutical drug.
Actually, it is a pharmaceutical drug that removes it, but the problem is the biotoxins like mold toxin, they cause two damages. They're directly toxic and they cause inflammation.
Right.
The drug we have will remove the toxic effect, but it will not stop the inflammatory effect, which is the bigger problem.
Okay, so there is no pharmaceutical solution other than just getting away from the mold.
Right. You need a short-term treatment with the pharmaceutical to remove the toxin in about 25% of cases.
Okay.
75% of cases don't need that treatment.
Okay.
But no treatment will work if you're continuously exposed to the toxin.
To mold. So I can see where people don't want the word to get out that their schools and their governmental schools and their office buildings in their
homes.
That's huge. And you also mentioned for the listeners that if you are in an older home like this with plaster, this was built in 1950, that there's lime, this is off-camera discussion, there's lime in this plaster, which mitigates the formation of mold, right?
It does inhibit it. Modern building techniques with drywall and wood, and if you don't caulk your windows right, or the roof leaks, or you don't wrap with moisture barrier, modern building techniques basically take lumber and low alkalinity drywall, which is good mold food.
My goodness. And you were mentioning that this one study ascertained that 50% or more of the existing schools today are mold-ridden?
It was actually houses. 50% of the houses have enough mold biotoxin load that they'll cause inflammation in a human.
Oh my goodness.
And unfortunately, 25% of the population has a genetic abnormality of its immune system, which makes them super sensitive to that effect, so they get sicker faster. Usually the people with fibromyalgia, chronic fatigue, chronic depression. These are the people who largely have this biotoxic illness process that's driving their illness. I would say it's probably true 80% of the time that I see these, especially when you see a young person who's got a severe neurologic or immunologic disease, that they very commonly have some form of biotoxin illness, and mold is by far the most common one.
So mold, and then the other big component of causing inflammation is, I guess, what we would call bad food.
Yeah, food and lifestyle. Sleep deprivation, but food by far.
Sleep deprivation?
Yeah, sleep deprivation causes it. We actually know you can sleep deprive somebody for 1 hour a day for 5 days. Raise
1 hour a day?
For 5 straight days, you'll raise their blood sugar, blood pressure, and cause cholesterol transport disorders.
Wow. I am just blown away at all this new information. I'm floored over. I mean, what?
Yeah.
Just 5 days of one. So if I go from 8 hours, which is what I'm supposed to have, let's say, to 7 hours, which I actually, maybe we even need more than 8 hours. Who knows?
Most people 8 hours.
Okay,
7.5 to 8 hours get most people taken care of.
Okay, let's just say 8 hours. If I go 5 days straight with 7 hours, and I go to you to pre-test and post-test, you're going to tell me that my blood pressure and what else?
Blood pressure, blood sugar, cholesterol, and markers of inflammation will all be altered.
Blood pressure.
And in fact, we have studies that have shown
marks of say that again.
Markers of inflammation, cholesterol transport, and blood sugar regulation.
Cholesterol, blood sugar, blood pressure. Doesn't that just about hit every chronic disease?
Well, and it should make sense. We have multiple studies that show that people who work night shift, who are fighting their genetically driven diurnal rates, they have much higher rates of heart attack, strokes, psychiatric diseases, immunologic diseases.
Psychiatric, we haven't even gotten into that.
The
mental illness.
One of the things I really mourn about traditional medicine is we teach psychiatric illness as a learned phenomenon. You know, mommy, daddy didn't teach you how to compensate, or you got raped when you were a little girl.
Oh, yeah.
And unfortunately, while that's very true,
what
we don't recognize is that, you can have all of those illnesses because of a metabolic condition as well. I mean, when you're depressed, you have a brain malfunction. It is not functioning the way a normal brain was. It interprets stimuli in an excessively inhibitory form.
Right.
And that can be done either because you've been trained to inhibit yourself, but it can also be done because you have chronic inflammation from mold, toxin, or bad food, and you've made your brain depressible.
So which gets back to the Alzheimer's patient, the CEO, when he went from 5% to 75%. You were talking off camera again a few weeks ago that the shoemaker protocol is necessary, that you can't do it diet alone all the time because, and maybe you can go into the shoemaker protocol, because you have to change the neuron function of the brain somehow?
So there's an area in the brain called the suprachiasmatic hypothalamus.
Okay.
A big long term we doctors like to throw around.
Right. I talk about the whatever that is.
Parties all the time.
With my son sometimes. He's getting a PhD in neuroscience, but he's like you. I'm like, you guys got to talk because, anyway, go ahead.
So this area of the brain actually controls the hormones that run your gonads, the adrenal glands, the thyroid gland. They control the immune system and the inflammation responses.
Okay.
And there's this thing built into every human being called the cell danger response. Okay. So whenever a cell starts to metabolize itself wrong, say it got a virus infection, it actually triggers this thing that prevents the cell from making new proteins and regulating its fat production. And cells are made up of protein, fat, and nucleic acids. Okay. And they do that because viruses can't make their own fats and proteins. They have to have you make them for them. Okay. So this cell is basically saying, I'm only going to make what I've already been making, and that way the virus can't reproduce in me until the immune system can win. Right. If you do enough cells like that, they secrete chemicals, and the area of the brain says, I'm going to make the entire body do that. I'm going to put the entire body in the cell danger response. And that's when you see people feeling the aches and the fatigue that comes on when you get a cold. And this is a protective mechanism, but it was designed to go on for only a few days until the immune system got the Th1 and Th2 systems running and got rid of the cootie.
Th1 and Th2 again. I thought we were done with that, but...
So the problem is, if you have a chronic inflammatory cause, say you eat lousy food or you get exposed to a biotoxin and this inflammation goes on long enough, remember the cells in the hypothalamus have turned off their making of protein and fat, and if it goes off long enough, now they start to function badly. And they cannot stop the inflammation anymore. They can't run your gonads and your thyroid gland right. And now, because those things aren't working right, the cells stay sick. And you are perpetually in a state of having your hypothalamus under function. Well, to replace that and get that working again, there are a couple of neurohormones that can be used. You can't get a patent on them because they're what your own brain makes to reboot the system, but that won't work unless you remove the inflammation. So in other words, you can't just squirt vasoactive intestinal peptide up your nose while you eat a cheeseburger.
Right.
You can't
so
get the
diet and the shoemaker protocol combined.
They are essential, that you make some dietary modifications or they just can't get the inflammation down enough. I don't think most people realize that you can actually measure the inflammatory mediators after a few days of eating really bad food, and you can watch them all go up, but there are reams of data that show that if you eat a high fructose or a gluten meal or a high fat meal, that you can actually cause inflammation to develop throughout the body.
Wow.
This is
like within minutes, right?
Some within minutes, some within hours. Some of them take days, but there's almost, the three major things that I tell patients to avoid in their diet and reduce. You can't do more than 2 meals a week and not have this thing start to accumulate.
Gosh, I can't. get over this.
As a matter of fact, we've actually shown that area of the brain gets damaged. Controls body fat regulation. So your fat cells make a hormone called leptin to tell the brain you have energy stored.
Oh, wow.
And if you damage that area of the brain, these people get something called leptin resistance, which means their brain forever thinks that they have no fat stores and are in starvation. And it responds and runs all of the other hormones as if it is in a starvation without any fat burning. And they won't burn fat because the brain thinks it can't go there for energy. And the studies have shown that when that happens, you can starve this patient or you can make them exercise like a demon and they will lose muscle and bone mass, but not body fat. In fact, we've all gotten into this, oh, well, it's all diet. And everybody's seen this thing where you had somebody go on to a wonderful diet and very little changed. Now, in medical school, I was taught to explain that by saying my patient was lying to me and I should make fun of them for doing so if we were to blame the patient.
Yeah.
But the reality is, and I imagine there's out there some overweight patient who has been on a very good, low-fat, low-fructose, low-gluten diet and nothing really got much better.
Oh, wow.
But the problem is they have this injury to the hypothalamus where they are not going to run things normally. And at that point, the only salvation is to have them go through a Shoemaker-Bredesen protocol to rehabilitate this.
Right. And is this a nasal thing you're saying?
Well, there's actually several steps in this protocol, and they have to be taken in sequence. If you don't do them in the right order, then the other steps won't work, and so it's a little complicated to take through.
So, it could be upwards of a couple months to 6 months protocol?
Especially if mold's involved, because you have to get out of the moldy environment for it to work. And so for the patients I have going through the protocol now, most of them are kind of getting to the end of that because they've been a year trying to get their house or their workplace cleaned up.
So if your brain hasn't been injured, which I hope mine hasn't, then, diet's fine. Diet will keep you maintained.
Well, and in fact, that's why we see the people who have done this. Wow, this guy lost all this weight and he didn't even have bariatric surgery, just changed how he eat and started getting a little bit of exercise and he started to lose all this weight and he got healthy again. Yeah, if you get it to before the brain damage becomes, then yes, you can pull that off.
How can you detect that there's brain damage?
You're probably going to have to go to somebody who's trained in functional medicine enough to evaluate you for a Shoemaker protocol.
Okay, so you can do that.
I can, yes, actually. I've been trained.
So how do you tell? Like if I come to you and I've got this inflammation and you want to know whether my brain's injured, how do you tell?
There's a series of 13 labs, and you have to fail 5 of the 13 labs in a certain way. And it's interesting. The laboratory normal ranges are almost none of them useful. They're all incorrect.
Really?
Yeah, the government requires a laboratory to report its normal range by going out and getting 100 people and calling the upper 5 and lower 5% abnormal. So, for instance, if you're trying to determine what normal testosterone is, you would get 100 guys, some of weigh 300 pounds, have no sex drive, bad cholesterol, bad blood sugar, and you say, okay, I'm going to call the middle 90% of you guys normal, and the other 5% are abnormal.
Doesn't make any sense.
So you're taking sick people and calling them normal.
Where your baseline is skewed.
Right. So in functional medicine, we're actually use different normal ranges for our labs. Our labs, they won't let you in the calculation for testosterone level if you have bad blood sugar, cholesterol, you have psychiatric disease, neurologic disease. You don't get to be in the normal range calculation. So when you do these labs, some of which are covered only at very high cost by insurance, and some not covered at all, many not covered by Medicare. And then we can go into how the price of the labs gets jacked up. But then after we do get these labs done, if you have a doctor who's trained to interpret them with the right ranges, then you can interpret that, yes, this person is showing injury to their hypothalamus.
Right.
And now I know how to go. I know you're going to need a Shoemaker protocol to fix you.
Wow.
Versus just going ahead and doing lifestyle intervention. Now, I think this is a great example, though, of how you can determine when a doctor is paid through the traditional system. Because that doctor now, even if you did find a doctor, I do know how to treat chronic inflammatory response syndrome with a Shoemaker protocol. Rather than start off and taking your history and saying, well, you have very little immunologic and neurologic diseases, your brain might be okay. We can give you a 3-month trial of just eating a wonderful diet. And then if everything's going right, we don't have to spend this, $700 in labs.
Yeah, that would be the functional doctor.
But if that would be the direct primary care doctor.
Right.
But if you're paid and make money on the labs you order, or your boss, the hospital, makes money on
the third-party payments,
you start off ordering $700 for the labs.
Exactly. And all the medication.
Right. And I tell people, you can see how the doctor thinks this is good. Well, I don't know you don't have chronic inflammatory response syndrome unless I order the labs. And the guy is right. You might still have it. I like this.
Let's try the 3-month lifestyle intervention.
Because we're going to do that anyway.
Get out of the mold.
Right.
Start, driving right on by McDonald's.
Right.
All this maybe plant-based diet or whatever. And you're talking to the choir here because I prefer vegan. I've been preferring vegan now for like 10 years almost. So, and I just evolved into that. But I wanted to get back a little bit to this beautiful, we imagine, visualize, and create here. So you obviously imagined and visualized, and now you're creating this beautiful new practice. Oh, I just get the chills. And you're providing this wonderful service. As you said, you're a servant, not a dictator. You're the rent-a-brain. You're not telling people what to do. You're telling them, you're educating them, and you're empowering the patient. I love this. And it sounds like your niche right now, such a beautiful niche, is this inflammation situation and this ability to implement this shoemaker protocol that you are so well versed in. And I'm just so excited to send people your way. Before we get to the end game here as to what you are creating, I want just to interject, and we'll do this at the very end again as well. How can people get a hold of you?
My website is www.purehealthmed.com.
Ooh, Pure Health.
And my email is drstock@purehealthmed.com.
Pure Health
Office
Med.
address is, office telephone number is 317-491-5272.
Okay,
I'm flattered by anybody who chooses me.
I'm telling you, hopefully I won't have to visit you anytime soon.
I hope you don't either.
But there are a lot of people out there that I know right now would benefit from your services, and all of the contact information for Dr. Stock will be under this video as well. So, what are you creating in your mind for people around the world that need your services? What are you creating for us?
Well, after the last employer clinic, I didn't get to tell you the result of that was after I got reprimanded for talking with the employer, I sent a letter to the manager of the clinic, said we need to find out what's going on here because I'm going to be uncomfortable with this. And they didn't respond for a month despite, I think, 2 further emails. And then after a month, they finally came back and said, we've accepted your resignation.
This is the county with the mold issue.
Right. They basically, I'm sure the county said, look, we can't pay for this. We don't want this.
Right.
We don't. So he needs to go. And at that point, I realized, the problem is that the money being spent on my advice is under control of people besides the patient.
So you can't fix the current system, but you could create a new reality for people.
And that's how Pure Health Functional Family Medicine came about. So, for instance, in my practice, it's written into your contract with me. I can't make money on anything I give you advice about.
It's written in the contract.
Yeah, that's the wording. And whether it's a lab or an X-ray or a supplement
so right
or a
up
medicine
front, you're saying,
or
I am
referral.
not bought and sold here. I am your servant. I'm not under the influence of money.
It colors the quality of the advice and the trustworthiness in the advice when that's there. I mean, I could feel it in the old system. They would tell me, Dan, if you go to this website, you can see how much more money you'd make if you provide statins. And I'm like, well...
let me interject another little thing, guys. So about the same time I rejected all the birth control pills and hormones and stuff and I didn't take any of that. I've never, I've gone through menopause. Obviously I'm old enough to do that. I didn't take anything. I ended up not taking anything. I just went through naturally. And I don't ever have hot flashes. I don't know why. I just gravitated away from a lot of foods that seem to exacerbate hormonal fluctuations. So intuitively, I just said, well, I'm not going to do that. I'm not going to do that. I'll do this. And so I just haven't suffered like a lot of people have. But on the statin, so I had what would be considered high cholesterol. It was 150 in around 40 years of age and stuff. But my HCI was 90.
HDL cholesterol?
Or HDI.
Yeah.
I'm sorry.
HDL cholesterol?
Yeah. My HDI, it's been a long time, was 90. Which jacked up the overall. And now, as you're an expert on this, you have to look at the overall person because the cholesterol doesn't tell all the story. Well, anyway, I kept telling all of my physicians that I would go to, I'm sorry, but I don't want to take, I was a non-conforming patient. I don't want to take, I appreciate all of your advice, but I am not going to take this statin drug. But and at the time, 20 years ago, Lipitor was like the miracle drug. Everybody's got to take it. I'm like, no, I'm just not going to take it because I wasn't on any drugs. I didn't even take supplements. So I finally changed physicians, and same thing. Oh, Lisa, you've got to take Lipitor or whatever statin drug was in the flavor then. And I just kept saying, no, thank you, no, thank you. And one day, the nurse of the physician called, my new physician. Well, Dr. Blah, blah wants you to go on statin drugs. And I thought, oh gosh, the new physician wants me. And I said, thank you, but no thank you. And she said, Lisa, this is the nurse, off the record, can I tell you something? And she started listing 12 more side effects that I hadn't even researched. I mean, I researched a whole boatload of them, but she gave me more. So I'm sorry to go off beat there a little bit, but I'm just telling you, we've got to, I love how you're giving power back to the patient, telling them up front in the contract that I am not bought and sold here. I am your servant, being your rent-a-brain, giving you information for you to make the decision because it's your body, it's your mind, it's your soul. I love that. So, I mean, continue your conversation if you remember where you were.
The other thing I think that's very important in this contract is I can only make money by selling advice. The advice can't be colored.
Okay.
And the other thing is it's cancelable. So I tell people, when you go to rent a post hole digger, the longer you rent it, the more hours you rent it for, you get a discount. So people can rent me by the hour, and then they can get subscriptions and rent me by the quarter, the semi-annually, or annually. Oh. But it's cancelable. But it has to be, doesn't it? I mean, if I'm giving you advice that you're losing trust in, because no doctor can tell you he knows anything with 100% certainty. So there has to be trust in that doctor-patient relationship. But if I'm beginning to give you reason to doubt my trust, should you not be able to get back the money that you've put in there for the 6 months you're not going to use? So I tell people you can buy me in bulk, and then if you 6 months into it you say, Dr. Stock's just an idiot, I can't stand this man, then you get a prorated bonus back. And these prices usually are lower than what you'll pay, especially if you have a medium or high deductible plan to go see your family doctor.
Nice.
The present healthcare system's become such a prepayment Ponzi scheme that the black market healthcare, which is what I refer to myself as, is now actually greater quality and lower cost. Just like
she agrees with you.
Yeah, that's right.
Greater quality and lower cost, the black market healthcare.
So a good example,
which is Pure Health Med.
One of the examples I'd like to tell people is one of my subscription patients had a friend of his who had an ankle sprain. And he said, well, I think you ought to go see my doctor. This gentleman came to see me and says, well, I've got an ankle sprain. And so I examined his ankle and I said, how did you hurt yourself? Tell me exactly what happened. You're running down the court. I jumped up for a ball. Came
Which
down.
A lot of times people don't ask, all the details.
The story will point this out rather well. So I examined exactly how he injured his ankle. And I said, well, so by the auto ankle rules, I can already tell you that I'm 98% sure you don't have a fracture or that you don't have anything other than a tuft fracture that we're going to treat like a sprain anyway.
Well, I'm impressed.
So I said,
by a story.
Science says I can do this. We have studied that. That's how powerful you can do if you do a good history and physical exam.
Yeah.
So I said, if that risk is too great for you, I'm happy to order an x-ray. You can probably get it done for $75 at these places. It'll take cash or use your insurance. But the other option you have is that we can just put you in a restriction brace that won't let you go into inversion, eversion, use crutches. If a week you get better, we'll know you don't have a fracture. If you don't get better, we probably do have a fracture, but you'll be just as treatable a week from now as you will now. It won't change your outcome.
That's key. I would want to know that.
Right.
Okay.
And so the guy looks at me and says, oh, well, okay, in that case, I'm not going to have the x-ray done. And I said, okay, great. And he said, well, then what do I owe you for the day? And I said, well, you're in here 15 minutes, 20 minutes, so it'll be $75. And he said, wait a minute, $75? And I said, yeah, that's all. That's all I need. He said, Dr. Stock, 6 months ago, I had an ankle sprain that was worse than this. I went into the local urgent care. The guy didn't examine my ankle as much. He didn't ask me as many questions. Didn't even come in the room till the x-ray had been ordered. And I walked out with a $450 bill. And all I'm paying is $75? And I had to say, well...
Spread the word!
You have to understand that doctor had some incentives on him that I don't have.
Right.
And I'm not going to criticize what he did. I'll let you decide whether you got better care for your money this way than the other.
And you're not as far out on a limb as the holistic doctors or the naturopaths. Can you tell us a little bit about the difference between a functional doctor and a holistic doctor or a naturopath?
I don't really know that I see a lot. It has to do with the level of your biochemical training. Many doctors who are into the holistic don't really know how to. A lot of people like to make fun of chiropractors, and in medical school I was told that was my professional obligation to make fun of them.
Oh yeah. No, I'm hearing it. It's not until just recently that chiropractors are not thought of as witch doctors or something. But
I think many of them give very good advice.
Yes.
I don't know about the benefits of manipulative therapy because I have no training in that.
Okay.
I think many times they have not studied biochemistry as deeply, but I don't see a differences other than that. I was at a lecture on Saturday by a chiropractor who had done great extensive study beyond his chiropractic training, knew biochemistry quite well. The biggest difference I think I would tell somebody between the holistic front and traditional medicine has to do with the ugly statistics. So as this healthcare prepayment spiral was inflating costs throughout the country, in the early 90s, middle 90s, the insurance companies decided, because everybody was screaming to cut costs, that they would develop an intellectual bar for what was real and was not real. And that was that it had to be proven with 95% certainty or we would not pay for it. So the problem statistically is, if you have a problem which has multiple variables in it, to get something proven with 95% certainty becomes an exponentially bigger and bigger study. And now, if you want to prove all of the variables involved in treating somebody with chronic inflammatory response syndrome, you have a study of 50 million people that costs more than the GNP of the country. So that automatically forces a very beneficial thing to a prepayment scheme. That means that we never have to pay for anything that would cure you, because you can't be cured unless we can do a study this large. And so the criticism that's been made on holistic or integrative practitioners is that, well, they're doing things and they don't really have proven what they're doing. Well, the question has to come up, proven to whose satisfaction?
Right.
Proven to the patient's satisfaction, or to the insurance company and the government and the employers and the hospital's satisfaction? So in a prepayment scheme, I can guarantee it's going to be very hard to convince these people that they're going to be satisfied with this. The other thing that's missed in this analysis, if I do a study with a statin drug that shows that with 95% certainty, taking Lipitor will reduce your risk of heart attack and stroke by 25%, which is what the studies show.
Which is paid by the pharmaceutical companies, which have all the money to do that.
And I can tell you that it's even valid science. They can tell you very validly that we have a 95% certainty of telling you will reduce your risk of 25%. But what they haven't then recognized is that also means with 95% certainty, I can tell you that 75% of the heart attacks and strokes are going to happen anyway.
Whoa!
So that I can tell you that if you do traditional medicine for a chronic disease, I can tell you with 95% certainty you will never be cured.
Wow.
And go ask the people with fibromyalgia who are taking Lyrica, does Lyrica cure them? No, they say I'm a little less sick. It never, if they stop the Lyrica, do symptoms come back? Yes, of course they do.
Right.
So the knock that's been made on integrative medicine is twofold. The first one unfounded, which is, they're doing something that has no proof. Well, it's not that it has no proof. As a matter of fact, much of the proof is placebo-controlled, randomized, and blinded with a 95% certainty. It's just not published in any magazine that a doctor can easily see it.
Right.
And the other argument that's been made about it is most doctors in functional medicine mark up their labs and supplements that they sell. And so that we're accused of wasting people's money. And that may well be a valid charge. I can tell you that I use much less supplements than I used to. I find less expensive supplements work equally well as more expensive supplements that don't have reps coming to my office.
That's so good, Dan.
And
Dr.
so
Stock?
This,
You're not stocking up as much.
I tell my patients when they ask me, do you mind if I call you Dan? I was like, look, you rented my brain. You can call me dirty words.
Or they can call you Dr. Dan.
So you can call me things you would hear in a hockey locker room if you want to.
Wow.
But the knock on much of integrative medicine is that, these guys are just wasting people's money. And I think, we're not a complete waste of money.
Because there's prescribing a lot of supplements
that are and they are
the labs.
It's not that they do nothing. The question is, well, could you get them cheaper, and are they worth the money the patient spends? Would you recommend somebody use
and
the
are
supplement?
they traditionally covered under insurance?
Oh no, supplements are almost never covered.
The supplements
under
or the
insurance.
lab is the lab?
Many of the labs aren't. No, for instance,
Right.
to terrify the population out there, we have great studies that show that if I give you testosterone by any mechanism, injections, cream, whatever, the blood test will not reflect the activity of that hormone.
Right.
So to get the blood level to go up, you have to give enormous doses of testosterone. But of course, the insurance companies don't pay for the other testing. And so most people who are getting testosterone therapy are getting 5 to 25 times the dose of testosterone they should have. So the next question is, well, is that bad? And the answer is, well, yes, the symptoms of testosterone excess are almost exactly identical to the symptoms of testosterone deficiency, only they're not quite as bad. So the patient feels better than they did before, but never feels as good as they could.
So who's giving more than testosterone?
Most doctors in traditional medicine.
Traditional is different than the holistic and functional. I just want to make sure the listeners understand that. And the third-party pay is the traditional doctor system, and the direct pay is the functional holistic, which means you're getting direct pay from the patient,
direct
and
pay
not
means,
from the insurance.
I tell you,
company.
you can be a direct pay doctor and not do functional medicine. And if anybody said to me, Doc, I only want 95% proven treatment, I would say, okay, that's great. Still, I can do that for you. Go get one of my colleagues who's a direct primary care doctor. The studies have shown that if you go to direct primary care traditional medicine doctors, they will still order 85% less tests, emergency room visits, ER visits, surgeries, than if you go to a doctor who's paid through an insurance company or a government. And you'll get the same health outcome, and you'll like your care better.
So, obviously, you can say in your contract, I'm not being influenced by the insurance company and all that, because the services you provide aren't being reimbursed by the insurance company. It's you just get the either by the hour or by subscription basis on a payment plan, the money directly from the patient, and they don't get anything from the insurance company either. They can't submit it to their insurance company.
They can submit it,
but usually they don't get
usually
paid.
They will not get paid.
Right.
And they can take it out of the health spending account or flexible spending account.
Right. Okay. They can take it out of the HSA, which is good. That's good. So, and they need to raise those limits.
I would definitely encourage that. That way people can self-insure rather than needing Anthem to insure them.
Right, which I saw in your treatise. You have a beautiful treatise that you... And just before we close, and I'm going to also let you wrap up with any more that we forgot to mention, but I do want you to talk about the recent changes in the tax bill on getting rid of the individual mandate versus the employer mandate on this the Affordable Health Care Act, Obamacare.
Yeah, I don't think...
Or now Trump Care.
Yeah. Well, this has been rather misleading as well, because remember the whole reason the Obamacare thing came about is this system was getting ready to implode, so we had to force more people to go buy private insurance.
Which you mentioned earlier. I understand that,
and of course everybody...
To supplement the Medicare and Medicaid.
Right.
Yeah.
So, of course, everybody in Congress is being lobbied to keep this going, which is why as soon as the Republicans won, they didn't actually undo Obamacare. Because they were being paid not to. Their lobbyists were paying them not to. But they had to look like they had undone it. So in this recent tax overhaul, they said, we did away with the individual mandate. And I think President Trump came out and said, effectively, Obamacare is dead. Well, the vast majority of people who have private insurance don't buy it as individuals. They are paid for by their employer because their employer is still required to buy them insurance by the Obamacare unless they have less than 50 employees. And so the vast majority of people are still being forced into this prepayment scheme indirectly through their employer.
Okay.
And the employers really want no part of this because it's bankrupting them. We have trouble as a country competing with other countries in our manufacturing goods. Last I heard that a car made in the United States has something like $1,400 added to it just to pay for the health insurance of the workers for the company. And so it's making us non-competitive. The employers really went out of this, but they're not allowed to get out of it. And I don't want anybody to think that the recent tax overhaul really undid Obamacare. It took a small percentage of people who were buying insurance and took them out of the prepayment scheme, but it left the vast majority forced to still be in it.
Well, this is really interesting because in order to bring back the companies that we outsourced to foreign nations. It sounds like what you're saying is we need to get more competitive in the healthcare arena to bring back those jobs in America.
And I don't think a lot of people realize
Right.
the financial coercion to make a employer stay in it.
Right.
And why would a patient, why would he possibly go buy private insurance in this situation?
No, not if you have it under your employer with the collective.
Right. Well, and why would an employer not just say, well, I'll give you guys the money, pay the fine? And, well, there's this other problem, which is all of the services that are out there, their prices are so terribly inflated, and the insurance company won't let you buy that on your own and count it towards the deductible. So an example I give people, because this is something they can also do through a direct primary care practice. If somebody says, I want a complete blood cell count, you can walk down to your local laboratory, show them your insurance card, and they're going to charge you about $25. And then that'll be applied to your deductible. Mm-hmm. And you can say, well, no, I'm going to pay for it cash. And that laboratory will say, okay, we'll give you a cash pay price. That'll be $20, but you can't apply it to your deductible. But that same laboratory will sell that complete blood cell count to me for $2.50. So I have to sell it to you at my price because in my contract it says I can't make profit on it.
Right, you can't profit, yeah.
So unless you have a direct primary care doctor who will do a contract with a lab and sell it at your price, then you are paying 10 times the price, so you have the privilege of applying it to your deductible, which is another thing that forces people to stay in the prepayment scheme. And so until we have laws that say insurance companies cannot refuse to put towards your deductible anything that you pay for your health care. If it comes out of a health spending account or a flexible spending account,
Right.
if we're allowed to take it out of there, the insurance company has to count that towards your deductible,
Right.
then the insurance companies are going to use this as financial coercion to keep people in the prepayment scheme.
Right.
In fact,
Wow.
sometimes when people hear me talk, they get the impression that I look down on my colleagues who are in the insurance third-party payment scheme, and I tell them, actually, I don't. I feel bad for these people.
Yeah, they're trapped.
And I kind of encourage people to, do your doctor a favor and fire him. Because as soon as this was something where nobody wanted a doctor through third-party payment, he would no longer be profitable to a hospital, and the insurance companies would release them all. They could all go do direct primary care, and they'd all be happier.
It takes one physician at a time here, and the more people that leave the third-party payment system and go to direct pay like you did, that's going to create a whole new system. And I just love your bravery. I love your willingness to leave that huge pay that you had to let go of. And for the viewers, I did the same thing. I was this hired gun, this lobbyist, not in the Washington, D.C., but in Indiana, for 35 plus years. And I represented the pharmaceutical company. I represented, casino, banking, credit cards, alcohol, all the, the whole gamut, insurance companies. So I got vastly educated, but I was trapped in a sense as well in the system, the pay-to-play system. And it became so uncomfortable that I finally had to just let it go prematurely at the end of 2016, letting go of a huge salary. And there aren't very many people like me. In fact, I challenge any viewers to tell me if there's anyone like me in the entire country that left, because it just philosophically and spiritually just didn't jive.
By the way, I was very impressed by your courage in doing that.
Well, I'm impressed by yours. I think we're a lot alike. We're kins in that way.
Well,
kinship.
To me, courage is my dad. He did 35 missions over Nazi Germany. The last 10 of them after his best friend's head got shot off in his bomber.
Oh,
and,
wow.
I got to see my dad suffer from those memories the remainder of his life. So this, to me, the bar's kind of high in my family for courage.
Yeah.
This doesn't seem like all of that. I think a lot of what motivated Elizabeth and I to go this route was, look,
your wife,
my wife Elizabeth, the most wonderful part of my life.
That's so good.
I think is that we realized that either Dan's going to learn to lie, which he's not good at, because my mom and dad and my wife deserve better than that.
Yeah. Or
he's unemployable in third-party medicine. He won't do what employers tell him. He won't do what the government insurance company tell him. I'm very afraid of becoming stupid.
Well, we're in a dumbed down, fear up program.
Yeah.
To me, it's like a computer programming, dumbed down, fear up.
Yeah.
And, either we're dumbed down to the point where, we just don't know any better, or we're feared up. We know better, but we can't. We're too scared to get out of the system.
And it is very frightening. Elizabeth and I think, would be honest with everybody. We're very scared right now that, gee, are enough people going to see that this is worth it? But on the other hand, it's growing.
This is the time to do this.
I think people are beginning to realize that the advice I get through, not necessarily through the fault of the doctor, because he has big financial guns at his hand. But the advice I'm getting is being coerced, and it is being transformed, and the doctor's being paid to stay uninformed about other options.
Paid to stay uninformed, and they're putting 6 patients in an hour. They don't have time to dig deeply like you did and read the actual studies. That they just, maybe the synopsis comes across their desk. They're lucky to read that, or whatever you call it.
Well, it's even
and
worse.
Even if it's available, because, like you said, a lot of this isn't even produced by the journals.
There's even a worse thing called board certification.
Right.
In fact, in the state legislature right now is a bill which I hope is going to pass to prevent insurance companies and hospitals from denying doctors membership and privilege based upon their board certification status. Nobody cared about board certification in our field until the late 90s because we all realized these tests really couldn't tell you whether a doctor knew anything or not. And these boards actually were just a group of doctors who got together and said, well, we think we're really smart, we're going to be boards. And so they weren't answerable to the entire field. But in the late 90s, as the hospitals and doctors got employed so that they could collectively bargain against the insurance companies said, well, we think we should pay doctors less if they're not board certified.
Yes.
And so all of a sudden these boards got some financial incentive for people to go take them and got power. And realizing where their power came from, these few people are on the boards who were also sitting on these government committees that developed the guidelines, then started making the tests so that you couldn't pass them unless you could recite the guidelines. So they became an indoctrination system. The doctor would have to pay $1,000 to take a course to prepare him for the board certification exam. Then he had to pay another $1,000 for the privilege of sitting for the exam. And if he didn't answer the questions right, he would become decertified. And if he became decertified, now the hospital couldn't employ him any longer, and the insurance company wouldn't give him privileges any longer. And so there was this ideological arm to make doctors think. So they studied what we wanted them to study, learn what we want them to learn, and keep them from doing everything else.
And like almost a brainwashing through that intense studying of the guidelines.
As a matter of fact, the American Board of Family Practice recently came out and said it would no longer allow you to use CME credits from functional medicine to be applied towards your maintenance of certification exam. So if you wanted to go study that, all of the money you spent studying that wouldn't even be good enough to get you your certification anymore.
Oh, that's crazy. And also, just to backtrack way back, when you were in med school, how much time did they spend teaching you nutrition? It's a
10-minute lecture.
That's it?
10 minutes.
4-year program?
10 minutes.
Well, I heard 45, but that's 10 minutes.
That may have been from a doctor who graduated after me, but I can tell you,
you're young. That's insane.
I would tell anybody, if I could convince myself of what I know now about diet after studying 45 minutes, no, you wouldn't know the chemistry nearly well enough.
You only got 10 minutes.
10 minutes, yeah.
No way.
Yeah, there's protein and there's carbohydrate and there's fat and then there's these vitamins and they're kind of necessary and moving on.
Oh, I'm really saddened. My bubble has just totally been burst today. Is there anything else you'd like to share with the listeners that we haven't covered, or any closing thoughts?
Well, the cat's now jumped off my lap.
Yeah, get rid of all she was really shedding. She loved you. Yeah,
the audience has been very kind to listen to me to this point. They want to contact me.
I've been thoroughly entertained and so enlightened with this conversation. Thank you.
I do tell people that you don't have to join my practice if you want to just say, hey, Doc Stock, I heard you speak. I want to know.
Okay, so you're recruiting other physicians.
Right now I'm recruiting. I have to fill my own practice first.
Okay.
I would love to have a partner once I've got it. Actually, if a guy walked in and said, Doc, I want to split your rent right now, I think I'd be okay. Well, let's talk about how we can make this work. As long as you're willing to not make money on anything you advise people about, we can probably work together. But,
as long as you're willing to put that contract together like me. Yeah.
I have a lot of people who, I don't want to to go see Dr. Stock money up front to find out about his practice. I tell them, well, you don't have to do that. If you send me an email or if you call, they'll take your phone number at my office and I'll call you back and I can say, hey, here's how the practice works. I can't give you medical advice because I can't really study your case over the phone, but right. I tell people, you need to know whether this system is going to be, you have faith in it or not.
Right.
And I want people to be able to get faith in it before they spend money on the thing, so they can feel that, okay, yeah, this is the way I want to get my advice from now on. Yeah. So I encourage people, if they have any questions, send me an email, give a phone call. I'm a guy who's trying to make money to feed his family by doing something that he can feel good about at the end of the day. And I'm happy to tell people why I think this system is better. I think if we had direct primary care, we would have more and more doctors offering functional medicine level of analysis.
Yes, and direct primary care means you get paid directly by the patient and not reimbursed by the insurance company.
Correct.
That can influence you.
So, for instance, most hospitals, they won't let a doctor have a new patient appointment for much more than 45 minutes to an hour.
Aww.
We schedule no less than an hour for a new patient in my practice, and for most people it's going to be 2 hours. Because I have to teach them about nutrition and to get a thorough history, so I don't have to order $6,000 worth of lab tests.
Right.
I can kind of winnow this down to, well, I already know you've got that one positive, so there's no reason to order that test.
Yeah.
To do that history and get that down just takes time. But this system was allowed so that I could spend the time with people using my brain, which I'm a geek. I like to use my brain.
Well, and going back to when you were 38 with Mel, you just intuitively had something nudge you. We need to give him this medicine during the weekend. Because you thought that was in concert with the cardiologist test or cardiology test, the treadmill on Monday. But if he hadn't had that, the nitroglycerin, he would have been dead maybe.
And I've always remembered that the thing that made me do that was the story he told me as I asked him questions. It was not the lab results. They're the ones that told me I didn't need to treat the guy.
Exactly.
It was the story that the man told me about his symptoms, how they came on.
That they were during his exercising.
Right. And that he said, I sat down, they went away, went back to exercise, they came back a little bit. And that's when he quit exercising. It was that story that I took the time to ask him, and that this is what actually made me...
Which should be asked anyway, because that's the red flag of a heart condition.
And asked by the guy who's going to make the decision. What's become so common in healthcare nowadays is because we need doctors to churn, as we get a medical assistant or somebody who asks all the questions, and the doctor comes in and reads what they got down. Yeah. Well, one of the parts of assessing severe chronic inflammatory response syndrome is a series of questions and symptoms, but they found out that if we just handed people the paperwork and said, answer these questions, the answers they gave were not predictive. It was only when the doctor asked the question and could see your response, so that the
nonverbal and everything,
and to realize that many of these responses would come back not black and white, and that then you had to say, well, you just said yes, but you
really were not saying yes.
Do you have this or do you have this? Well, I have this. Okay, now see, that's not what we're looking for. But did you notice? Do you do this? Oh, yeah, that I do. Okay, now that does count, and the answer is right, and you would have marked it wrong.
Wow! So the the personal communication cannot replace a quiz.
It can't. A series of black and white yes/no answers can't give you the
phenomenal
shades of gray.
Now this is a huge disclosure here. I mean, really, just the personal communication.
Right.
So this has been so enlightening for me, as I said already. I love how you've taken this leap. I know you're going to do well. The time is right to do what is right. You have done what is right. And I know you're going to be able to look at yourself in the mirror for the rest of your life and, just feeling so good about what you're doing, being able to be this rent-a-brain, walking computer geek, and also have this ability to listen to your intuitive messages, to connect the dots holistically, functionally, integrative. Oh, I just can't even, I can't recommend this man more than, words just don't do it.
I always kind of remind myself, and I would tell every patient whenever they've been told by some provider or another, oh, here are the things we know about you. The labs and the studies we do, they can describe you, but they can't define you.
Oh, that's
the only person who can define you is you.
Yeah.
Your doctor can help you interpret those descriptions. but you are much more than your labs and your x-rays and your treadmill report.
Right.
And your story and what you know carries great amounts of information.
Right.
And don't let anyone talk you off this. One of my patients I just saw recently said, well, when doctor put me on an antidepressant, I felt much better. In fact, I felt pretty good. And they said, well, then we should raise the dose. And that never made sense to me. And I said, well, maybe it shouldn't make sense to you.
It shouldn't, and good it doesn't.
And she said, well, the doctor said, but this dose is the effective dose. I just had you on the starter dose, so this is the effective dose. And I said, but you've already had an effect, right?
Yeah, you've already had an effect.
So should that make sense?
So just do more. Put more fire on the fire. What? Well, the beautiful thing about functional medicine is that you're looking at the entire system and you're thinking outside the box. You're not influenced by the prepayment system, the insurance companies. And you're doing what we really need in this world. Creating a whole new healthcare template. And I just say hats off to you, because the more and more physicians that take this leap and do what you're doing, the better off we're going to be healthcare-wise. Because my understanding of traditional medicine is, as you said earlier in this interview, it just is a maintenance. It sort of just, it kind of just keeps the disease in place rather than helping the patient get rid of it.
I tell people it's to keep you profitably sick.
Is this a no-brainer? I mean, thank you, Red Brain Doctor. I want cures. And basically what you can do through the Shoemaker protocol or whatever else is you can help the patient cure themselves.
And I think that's an important point, because when you look at the people coming in, not everybody who goes to see a family doctor with diabetes or cholesterol problems needs a Shoemaker protocol.
Exactly.
Most of my patients just need to learn how to read a food label so they can survive a trip to Kroger. They need to learn that changing the batteries in your remote control isn't exercise. But on the other hand, you don't need to be an NFL athlete either.
That's a good one. Changing the batteries in your remote control is not exercise. This is, Red Brain, you are right on. Okay.
So quantifying much of this, we have a tendency to approach exercise and diet as, good, bad, meat bad, this good. Well, I tend to do more of the, how much of meat of what kind is bad? That's what you need to learn.
Right.
How much exercise will make it good? I mean, our studies say that if you walk briskly for 30 minutes at a time, totaling 4 hours in a week, you have all the benefit of an NFL athlete. If you do more than that, I tell people you get bigger dinners and bigger trophies, but you don't get less cancer, heart attack, and stroke.
Yeah.
So now you can decide whether you want the trophy and the bigger dinner, or would you rather just walk the 4 hours and have the health? And
that doesn't seem as overwhelming to people either.
I think much of when people, one of the lectures I went to at the the National Lipid Association, they actually had a doctor take the stand and say, we should quit advising people on lifestyle modification because they won't do it anyway. That's actually from the podium, this man said that. Who did a lot of research for pharmaceutical companies too, by the way.
Keep pumping the pills.
And this was really horrified me because, first of all, they can't do what they don't know. And second of all, they don't know it in depth. If they don't know the amounts, if you tell them eat better but never tell them how to read a food label to determine what better is, then the reason they don't do it isn't because they're so stupid they can't do lifestyle modification. It's because you never gave them the tools to act on this. But we make lifestyle modification seem so horrifying to people because we tell them exercise more, eat better.
How do they do that?
And they don't
you're
realize,
actually teaching how to read the labels.
Right. And I would tell them that, somebody says, well, Dr. Stock, I take a brisk walk with my mom every day for 30 minutes. I know that doesn't count. Oh, well, no. Wait a minute. That does count. Or you see the guy who's been pumping iron, he's frustrated because he hasn't gotten any healthier, and say, well, maybe you don't need to pump iron. Well, I just hated all the iron pumping. Well, maybe you don't need to do that. I mean, if you
one size fits all.
Right. Well, what if I swim? I like to ride my bike. Groovy. Do it 30 minutes. Do I have to run the Tour de France? No. 10 mile per hour will get you there. It's not even a hard bike ride.
And this hits the nail on the head for that old cliche. The beauty of your practice is you are a servant to the patient on a case-by-case basis, helping them discern what their constitution is made up of and what's good for them. And I just love how you don't push the lab test right away if they want to choose the diet first for the first 3 months, as you said, and all of the things you offer. I mean, this is huge. I'm just saying it's huge. And like I said, I hope I don't need to come to your office anytime soon, but I know where I'm going when I need you.
Oh, thank you.
And I say that to all the listeners out here. Oh, I've just got chills in my body. Thank you, Dr. Dan, Dr. Stock. I love what you're doing, and I can't say thanks anymore. The words just don't come. I mean, this is huge. So thank you.
Thank you very much for having me, Lisa. I really enjoyed it.
And be sure to look under the video on how to get a hold of Dr. Stock, and recommend him to all your friends and family who might be in a need of his services. Thank you, and please stay tuned for our next episode. Bye-bye.